Welcome, everybody, to Rewired and Desired, where intimacy and mindset and disability intersect. My name is Nicole, and I'm your co host. And I have my lovely co host here, Trina Ricketts. And today we are going to discuss pain medication. So, pain medication usage, along with some of the things that Trina and I have found in our ostomy and our pain journeys that have been working for us to manage pain with or without pain meds. So getting into it, Trina, why don't you start us out?
Sure. So this is a subject that can get me pretty riled. And before I start, I just want to tell the audience that I have a cold right now, so that's why my voice might sound different. And if I have to cough or blow my nose, I'll just go over here and try not to be too noisy. But my pain medication story was very traumatizing for me because my first ostomy surgery was an emergency surgery. I had a perforated bowel and I was in and out of the hospital for like 2 weeks before they discovered what was going on. By then, it was too late to save my bowel. And
Mm.
like a lot of people probably watching this podcast, I had to get an ostomy. And I was in the hospital for about a month and I was on pain meds. And I had no idea that, like, this is how naive I was. Even growing up in a family with addiction and everything else, because it was like street drugs that my family
Hmm.
was addicted to. None of them were addicted to pharmaceutical drugs. I
Hmm.
really didn't know anything about like the addictive nature of pharmaceutical drugs. And I didn't know that they were giving me something that I would develop a dependence on, a physical
Hmm.
dependence on. So they send me home from the hospital at the end of the month, and I'm really frail. I'm weak. I can barely walk. I had to learn how to walk again, like train my muscles again. Like
Hmm.
I have to pull myself with the railing up the stairs. That's how frail I am. And people like start crying when they see me because I was skin and bone and stuff. It was just so messed up.
Hmm.
And they have no directions about the pain meds except for we've got some pain meds here for you, and this is the prescription.
Hmm.
And the prescription ran out in just like, I think, a few days.
Hmm.
And at that time, it was really close to Christmas, and my family doctor was away. So, and with pain drugs, you can't get them
Yeah.
unless you go to your regular doctor. It depends on where you live, I guess. But here, they're very strict about who you get pain
Hmm.
drugs from, and only certain
Yeah.
doctors can prescribe them. So I thought immediately when I started going through withdrawal that I was just having pain
Hmm.
because my pain meds were gone and withdrawal from it was Dilaudid that I was on. One of the
Oh.
main symptoms of withdrawal from Dilaudid, or also known as hydromorphine, is that your intestines will start to like spasm and clench. And I had just had intestinal surgery. And it was a similar feeling to what I was feeling when my bowel was perforated. So I literally thought, oh my God, is my bowel perforated again? And I was
Hmm.
like stressing out. So at first I thought it was because I couldn't get pain meds, right? But
Yeah.
then the pain was getting worse and worse and worse. And Advil and Tylenol weren't helping, and nothing I could do was making the pain go away. Then the intestinal spasms got worse and worse to the point where I was scared I had a bowel perforation. So I went to the
Wow.
hospital. This is like 3 days before Christmas. I go to the hospital and I say, I'm in so much pain. I think that maybe my bowel's perforated again. Like
Yeah.
this feels the same as it did before my surgery. They do a test. They're like, your bowel's fine. It's not your bowel. And they
Yeah.
look at me completely scrawny and think that I'm drug seeking.
Right.
And
Right.
I'm like, well, I'm in so much pain. Can I get more like drugs for this pain?
Yeah.
And they're like, sure, we'll give you this stuff. And it wasn't hydromorph, it wasn't Dilaudid, right? So they give me this other pain med. I'm so grateful. I go home, like I'm trying to prepare for Christmas and I can't even get out of bed.
Yeah.
And I take this other stuff, but the pain doesn't go away. It's still getting worse. I feel like I'm dying. Like I
Gosh.
feel like I'm fucking dying?
Yeah.
And so that day, I go to the hospital again and they treat me even more dismissively and like I'm drug seeking. This time they give me
Wow.
a shot of some kind of pain reliever in my ass. And it's not Dilaudid, it's not hydromorph. And still,
Yeah.
I have no idea at this point that I'm going through withdrawal. I just think I'm in
Yeah.
pain. I have I don't know what's going on.
Yeah.
But
But
this
yeah, how would
time,
you know, you
yeah,
know?
this time I say to them, listen, the only drug that seems to work for my pain is Dilaudid. can you please give me the same pain med I was
Yeah.
on before because that's the only one that's working. And they obviously just took that as I was drug seeking, didn't even tell me that they thought I was drug seeking,
Well, they won't.
just treated me like I was a piece of shit. You know what I
Hmm.
mean? So I go home again, hoping that this injection in my ass is going to take some pain away. It doesn't take the pain away because it's not pain. It's withdrawal, right? Next day, Christmas Eve, I go to the hospital again because I just so badly want to be able to spend Christmas morning
Hmm.
with my children. And I
Yeah.
still think I'm just in pain from the surgery. So I go in and they are treating me like shit again, like refusing to help me. And this time I say, "Can I see a social worker? Can I talk to an advocate?"
Yeah.
And they got a social worker down to emergency finally. And she comes into a room privately with me. And I explained to her, like, at the time I was a marketing manager for a nonprofit. And I
Yeah.
had 3 children and I had like a normal life. Like I was
Yeah.
not a drug addict,
Yeah.
basically. I was trying to
Clearly.
explain to her, like, I don't think drug addicts should be treated this way, but
Right.
I'm not a drug addict. I
Yeah.
just need help. So they finally give me Dilaudid because of her advocating for me. And I go home. It's Christmas Eve. It's like midnight, and it's just too late for the Dilaudid to catch up. So all Christmas morning, while my kids are opening presents and stuff, I'm just puking and lying in bed and
Oh my
puking and lying in bed.
gosh.
And I couldn't spend it with them, and it was just so heartbreaking. I feel like crying just remembering how
Mm.
sad I was, and how
Yeah.
mad I was that they took that away from me at the hospital.
Yeah. Yeah.
And now I'm starting to feel better after all of this. I'm starting to feel better. I'm lying in bed. I get on my phone, or was it my phone, or did I get up and look at my computer? I can't even remember.
Yeah.
But I decided to look up the pain I was going through. I looked up Dilaudid. I started to research the meds, and that's
Yeah.
when the first thing that started coming up in the search was withdrawal, withdrawal. And I was like, oh
Mm.
my God. I've been going through
Yeah.
withdrawal this whole time and didn't know it. And they were treating me that way because they knew it,
But
but they
why
were
didn't they tell?
refusing to give it to me
But I don't understand either why they couldn't tell you that, you know?
because
Like, why would they not
they were
say, like,
judging me.
hey,
They were judging me and thinking probably thought I knew and I was putting on an act.
yeah,
You know what I
yeah,
mean? But I
right,
wasn't.
yeah,
And so anyway, so then my doctor finally gets back into town and I tell her my horror story and she prescribes me a bunch of Dilaudid and they told me to wean off of it, skip every other dose. That's not how you wean off of it. Don't ever listen to anyone who says that. I had to like just like lessen every other dose. And
yep,
it was over like a couple of weeks to get off of it for me
yep,
anyway. I've heard of
yep.
people doing it cold turkey and I can't even imagine because it made me honestly so sick and so unable to cope with life that there was just no way that I could have done it
Oh my
cold
God,
turkey like that. I don't
that's
think.
that's crazy. But it's not crazy because I have a similar story. It's not. I don't think to the length of yours, the extent of yours, but if I if you and I have both had this happen, can you imagine how many other people have this happen if you and I are saying like this has happened to us? So my story was is I had a resection done on my intestines due to my Crohn's and I was in the hospital. I get out and I was still had a fever. I mean, they let me out of the hospital. Was a 5 day stay. They let me out of the hospital with this fever. I go home and I've told this story before and I ended up with C. diff and leaking out my intestines, all sorts of things. And I ended up almost literally passing away in my home, right? If my ex wouldn't have been there at that time. So he brings me to the hospital. I end up in the hospital for another 3 weeks. So by then but they had to figure out that it was even C. diff. They had to do all the tests. It took a long
Mhm.
time. When I was finally well enough, I got to go home. So I'm home for another several weeks, just getting better. I mean, it was at least another month before I even got to go back to work. But in those weeks, they sent me home with pain meds. And I know in the hospital I was on Dilaudid. I had like that pump at some point. But when they sent me home, I think they sent me home with oxys, and I still had Vicodin, I want to say. And so I was taking oxys consistently for the pain. And when I was finally starting to feel normal, I remember one day I finally went out with a friend to lunch when I was finally back, right, or getting there. And I go out to lunch and I come home and I was like, why am I feeling hungry still? Like, what's going on? Like, my body just feels weird.
Hmm.
And I couldn't figure it out. So I took a Vicodin and the pain went away. Like everything that was like going on inside of me went away. So I just figured I was going through withdrawal. I didn't know
Wow.
either. I had
Mm,
never either been on I had been on pain meds in the past, but never for this length of time. I mean, now
yeah,
it was like 2 months probably that I was on consistent pain meds.
totally.
Um, and probably high doses, like even Oxy's pretty, strong.
Hmm.
And then um, I didn't, like I said, I just didn't know. And I just figured it out that that's what was going on. And I think it was just instinctively and intuitively that I just started weaning myself off with the Vicodin to be able to feel good and go throughout life. But yeah, no one told me. And here's my thing is I felt shame for it because I thought, oh my gosh, like my dad was a drug
Hmm.
addict,
Yeah.
right? But like you, it wasn't prescription meds, it was
Yeah.
crack, cocaine, like that kind of thing.
Mhm.
And so for me, it was shame around
Addiction.
addiction. Like
Yeah.
never did I have even a addictive personality, you know?
It's so
And
different though. Addiction to me is mental. I need this.
yeah,
I need this.
yeah,
Physical
yeah.
dependence is more like that's just the withdrawal, you
That's
know?
the withdrawal. Yeah, right, right.
And
But I
like
didn't
for you
know
were
that.
probably like me. You probably still were like very committed to get off the drug, right?
Yeah, oh, for sure. I mean, I
Yeah.
was working at a police department. I didn't want
Oh,
that stigma, that I was a drug addict. So I didn't
yeah.
tell anybody. And this is the first time I'm
Mhm.
even really talking about it, honestly, besides
Wow.
I've told you about it. Yeah, just because. And there's been a couple other times since then that I had to be on pain meds long term and but I recognize it. I'm like, "Oh, I'm having a withdrawal."
Hmm.
So I always now, always if I have been on any length of time on a medication like that, I will make sure that I spread it out so that I have enough so that if this
Okay.
happens, I can wean off again.
Hmm. Me too.
That's crazy, but yeah,
I actually
never.
started hoarding dilaudid. I started hoarding
Yeah,
them so that
yeah,
if I ever go through a surgery again, I don't have to depend on them to make
yeah.
sure I can wean off at the right
Right,
rate. I've
right.
even brought them to the hospital in my purse because I don't trust the
Wow.
doctors. Because you know what they've done to me, and this has happened more than once, where they start to taper off my pain med without telling me, putting it in through a butterfly, and I'm in the hospital. And because after that, I was in the hospital a lot. I had multiple
Sure.
bowel blockages,
Yeah,
abscesses, like just
yeah.
one thing after another, and then another ostomy surgery, and the same thing happened then.
Mm,
They told me that people don't get addicted or go through physical dependence on painkiller until they've been on it for 3 weeks. And I call bullshit because
yeah,
if your body has gone through it before and gone through withdrawal, then it's almost immediate for me. Like
yeah.
I could probably do 2 or 3 days, but a week? No.
Right,
Like for
right.
me, honestly, after 3 days, I start going through withdrawal when they take it off. And that's what
Wow.
they did. It was like the fourth day, the third or fourth day. And I was planning to just wean myself off when I got out of the hospital.
Yeah. You know
And
what to do.
yeah, like I always do because they don't know what they're doing. They literally do not know what they're doing. They brought a pain person directly to me to explain to me that no, you don't go through withdrawal unless you've been on it for 3 weeks.
Mm,
But I'm like, I'm going through withdrawal because you
yeah,
tapered off without telling
yeah,
me.
yeah,
And it's just the worst feeling in the world when they don't listen to you. And the last
yeah.
time they actually sent a social worker to see if I was like okay mentally, like and
Oh,
okay,
yeah.
like if I could be trusted with my children or if I was a drug addict. Just because
So
I was upset that they were tapering me off without telling me
yeah,
and too
I've been,
fast, you know?
yeah, oh, yeah, 100%. I've, since my mental health issues and since I've put myself in, I checked myself in a few times for suicidal ideations, I cannot go to a hospital without being flagged somehow.
Oh, I'm sorry.
Oh yeah, it's in my records. It's never gonna go
Mm.
away. So now, right away, I mean, I guess my accident, I mean, right away they gave me whatever they gave me in the ambulance, and when I got there, they kept giving me pain meds, but you still can't help to know, like you already know, right? So like if wasn't just in a serious accident, and I go in and say, I think I have a blockage, which I
Mhm.
have, they don't
Yeah.
still haven't taken me seriously. You know,
Oh yeah.
I've spent the night in the hospital.
I've lied in emergency for
Me
like
too,
hours being
with
ignored
nothing.
with a
Yeah.
blockage and
Yes.
knowing that it could burst my bowel at any moment.
Yes. Me
Oh,
too.
the worst.
Throwing
Yeah,
up, and then just been like, no big deal. It's like, are you
yeah,
serious? Like,
yeah.
I'm dying here, you know? Can
Yeah,
take care of
this is a medical emergency. Like, please
me.
help. But you're
Yeah.
too sick and too weak to advocate for yourself. And at
Yeah.
the time, I wasn't with a man who would advocate for me.
Yeah.
So I
Yeah.
always had to like either advocate for
Same.
myself or just sit there quietly and suffer until someone finally came and got me.
Same. Same. It's rough out there, I'm telling
It
you.
is.
So let's think of some, I mean, I don't have to think of it, but I think we should talk about some of the mental aspects behind it and ways that we manage it. And like you said, you keep some on hand just in case you need it. You
Yeah.
know you don't have an addiction. You
Yeah.
know that it's your body. You know what you need to do. I'm
Mhm.
the same. Now I know what I need to do. I'm well prepared. I would never want to feel that way again.
Mm.
Um, what are some of the other ways that you found for managing your pain besides pain meds?
I mean, pain, like we were talking before we started the podcast about how pain completely envelops your entire being.
Mm-hmm.
Last week my back hurt so bad that I could barely walk or
Mm.
move for a whole week. And like I couldn't even think straight for the whole
Ugh.
week.
Mm.
Mentally, it takes such a toll on us.
Mm-hmm.
This week I have a cold. I'm sick, but I can still think straight.
Yeah.
But pain it just devastates
Yeah.
us, right? So
Yeah.
mentally, it's really important for us, obviously, to try to stay strong, to
Mm-hmm.
get through it. And one of the things that I do is I try to just distract myself from the pain.
Yeah.
So
Yeah.
I'll watch movies or I'll,
Yes.
YouTube videos or listen to things. I lie down a lot and I
Mm-hmm.
rest a lot and I try
Mm-hmm.
to imagine I'm somewhere else and imagine I'm not, feeling that pain or
Yeah.
sometimes I've done this like when I'm getting a tattoo where I imagine that I love the pain,
Because some
you
people
know?
do. Yeah.
Yeah, it does help.
Mm-hmm.
It's amazing how
Mm-hmm.
much it helps actually. How about you, Nicole? What do you?
So, so I've noticed too, and I know there was a study done on this, and anybody that's in pain does not want to hear this, right? Like you just don't want to hear this while you're going through pain, because I just wanted to like kick somebody in the shin, right?
Hmm.
But honestly, you said watching movies, and they say if you watch things that light you up, it's there's the neurotransmitters in your brain, don't react to the pain. And I don't know the exact science behind it, but probably the dopamine and all the different things react and causing, a response in your body for the pain to feel like it's subsided. I can honestly tell you, so I've dealt with a lot of pain in my life, right? And um, since the accident, I have now more chronic pain. So I have vertebrae that are messed up. I have arthritis. Now I have osteoporosis. But neck, back, hips, like all of it. Um, and now I'm going back to physical therapy and getting all these other tests done and now that I'm back home. But one thing I've noticed is since I have been I'd say like I want to put it up here, right? Like I've been feeling very elevated and high on life. Just
Hmm.
things are just like really going so well for me. Like I feel like I've crossed this threshold of I don't know what it was, like mindsets that were just kind of still plaguing me a little bit. But since I crossed this threshold, I think I was trying to get past, like really haven't had any down feeling days. And the pain in my knee, which still needs addressing, we're pretty sure it's the meniscus. Um, I'm not even feeling the pain. Like I know that it's still bothering me because I can't get up and move the way I used to or get on my knees like I used to. But I have noticed that the pain has subsided substantially
Hmm.
because I'm just riding this high wave for now a few
Yeah.
months.
Yeah, well, I
So,
absolutely believe that because they say in a lot of reading I've done too about how trying to heal with our minds, obviously, I think everyone will agree with me that we can't just completely heal our bodies with our
no,
minds. We gotta
right.
we gotta eat better, take
Yes,
supplements,
yes,
detox, take medications,
yeah,
go to the doctor, go to the naturopath, or whatever
yeah,
we need to do to
yeah.
heal our bodies. We can't just do it with our minds. Maybe some people can and some people have. I've
Yeah,
tried. I have freaking tried and it didn't
yeah.
work, but changing
No,
my food worked and changing, things
yes,
like that worked.
yes.
But at the same time, when you're in a higher frequency,
Mm-hmm.
then you experience less pain
Yes.
and less
Yes.
suffering and less
Yes.
struggle. And so
Yes.
getting into a higher frequency, the higher frequencies are, like you said, joy,
Yep.
feeling like you're
Gratitude.
gratitude. That's the best one, I think. Gratitude,
Hmm.
joy, authenticity,
Hmm.
happiness, love,
Yeah.
you
Yep.
know,
Appreciation. Hmm.
appreciation. Yeah.
Yeah, I agree. Like it can't heal you 100% because we still are suffering in the human condition and we will
Hmm.
always suffer in the human condition. So we'll never be, Jesus or Buddha or any of those people who can heal, right?
Hmm.
But we can do our best to focus on those things like you just said, Trina, like all those
Hmm.
things are really good. And then two, one thing that's been working a lot for me is the intermittent fasting, and I think you said you do the
Hmm.
same thing.
Yeah.
That's huge. That's
Yeah.
huge. The body needs time for the stem cell regrowth, and the only way we can do that is by putting ourselves in autophagy. And I found a tremendous amount of pain relief just by doing that intermittent fasting.
Yeah.
And then doing like a good 24 to 72 hour fast when you
Mm.
can,
Yeah.
maybe every few months or so. I like to kind of follow up with one of those.
Yeah.
It sounds more difficult than it is, but I think that's part of training your brain because like we just think we need to constantly eat and we
Hmm.
don't. And so
Yeah.
if we can train our brain to have control, we can train our brain to release some of that pain as well.
Hmm. Yeah,
So,
fasting can be like hard on people who are low weight or underweight, which I
hmm
found out the
hmm
hard way. But yeah, like a 24-hour fast, anyone can do that, no matter what weight you are.
Yeah.
And like what I used to do a 24-hour fast every week. This was after my first ostomy surgery because I was just
Hmm.
like wanted to heal and I was in a really bad
Yeah.
marriage and I wanted to get out of the marriage. So I just wanted to
Yep.
be well enough to get out of the marriage and
Yes.
be able to take care of my kids. So I was trying everything and the intermittent fasting and the weekly 24-hour fast really helped
Mhm.
because my intestines needed a break.
Yeah. Yeah.
And also when our body is going toward putting energy towards digestion, it's not putting energy
Yeah.
towards healing the other
Yep.
parts of our body that are
Yes.
causing pain.
Yes.
So that's another reason why
Yes.
it really helps with pain. Another reason is because when we eat, often the foods that we eat can contribute to like our arthritis and whatnot.
Yeah.
I
Yeah.
notice for me, like sugar gives me arthritis. And
Yeah.
there are a lot of foods that turn into sugar when you eat them, like bread
Yes.
and pasta, any kind
Uh-huh.
of grains. So those kinds
Potatoes.
of things can make arthritis worse for me if,
Hmm.
if I am eating too much of them and I'm not doing
Yeah.
the other things that I do to make sure I'm detoxing my body.
Yeah. Yeah.
But definitely like intermittent fasting is amazing. And also another thing that's really good. Oh, I was gonna say how to do a 24-hour fast. That's really simple. Is you eat your dinner, you eat all day, you eat your
Yep.
dinner and you stop eating after dinner. So say you have your
Yep.
dinner at 6 and you finish at 6:30, then you don't eat all night and all the
Yep.
next day until 6:30.
Yeah. It's not that difficult.
Yeah. And then at 6:30 you have your dinner. So you're really only
Yeah.
skipping breakfast and lunch for one day.
Yeah. Yeah.
Yeah.
Yeah. And then I when I do that, I kind of fill up and kind of eat more crappy that whole day just because I know that I'm gonna be craving that if I don't. So I'm like, get it in and
Oh,
then
that's funny.
yeah,
I
I
don't
know.
do that, but but hey,
Okay,
I
okay,
know
don't do
people
that.
who like eat really healthy all the time and then they have one cheat day a week where they can
Yeah,
eat whatever they want,
I
and that
used to
works
do
for them.
that.
So
I used to
every
do it.
like
It didn't work for me. That weight
yeah.
loss, like trying to lose weight and get in shape for that really didn't work for me. And I did it for a long time. But I will say, by doing that, by doing the 6 days of eating really good and watching my macros, and then one day of eating whatever I wanted, really got me to the point where I could do these fastings. Because right now, most of the time, I'm only eating between a 4 hour window, at tops, a six
Mhm.
hour window.
Yeah,
So
wow.
yeah. Yeah.
Yeah.
But I feel good doing it because like you said, for the digestion, it's
Mhm.
helped my digestion. Like I went through this little bout just recently, but it was just stress
Yeah, that's
as my
crazy.
as my MRI shows.
Yeah.
So I don't know.
Yeah.
Yeah,
How I handle my treats, which in case this helps anyone, since we're on the subject, is I usually have two meals and a snack every day.
hmm.
And after my meals,
Yeah.
I might have a little bit of chocolate. And
Nice.
that's my treat. But I have
Yeah.
it right after my meal. That way my meal
Yeah.
is all at once. There's no
Yep.
snacking in between.
Yes. Yes.
And then I get my little sweet treat, but it's not too much, and
Yep.
I'm not hungry at the time because I just
Yep.
ate, so I don't overdo it, and
Yep.
yeah, it works
Yep.
for me.
I do the same. I try to get it in. Otherwise, you're right. Like by 8 o'clock, I'm like, I want something. So if you get it in right away, then you're gonna beat that craving. So
hmm
yeah.
Another thing,
Um,
like I think
mhm,
you're really onto it with the whole fasting for pain. Even just like when I started, so I had really bad back pain last week, and then I started to get this cold, and I took like oregano drops in water
yeah,
3 days in a row.
yeah,
And it almost made the cold go away, but then it came back, and I finally was like, I've been fighting this cold for weeks. I've been
yeah,
trying not to. I finally just said, oh, I'm just gonna let myself get it and get
yeah,
over it, you know?
yeah.
But the oil of oregano took my back pain away.
Really,
Now,
I
how
have
did it
heard
do
of that.
that?
I don't know, but I've heard of that one and I've never used it, but I want to.
I mean, I just think like oil of oregano, it gets rid of like it's antibacterial and it's
Hmm.
antifungal and a bunch of things. And I've always thought that my arthritis, and I think my back pain is a lot of it from arthritis. Um,
Uh-huh.
I've always thought that my arthritis came from taking antibiotics. So I feel like there's a
Mm,
bacterial component to
that
my
makes sense.
arthritis.
That makes sense.
And so I think like it just blasted my back pain away. It was amazing.
Yeah. Nice. Well,
But it
there you
just goes
go.
to
There's
show
another.
that, yeah, that
Yeah.
our pain can be managed through like healthy habits, but
Yes.
obviously not always. Sometimes we're just going to be in pain. We just had a surgery, or we put our back out, or we had a car accident,
Yeah.
or
Yeah.
we're
Yeah.
just going to be in pain.
There's a reason and a time to have to take pain meds, and then there's a reason and a time to not take them. And I think it's important to distinguish, know what, if you're someone who's already has an addiction or has an addictive behavior, being cognizant going into that, and knowing that, this could be a huge trigger for you. But if you're not, just knowing that you could become somewhat physically dependent if you don't manage it right. And you may have to manage it right for yourself. You're
Yeah.
ultimately responsible for your body, even if, someone else is telling you different. And,
Hmm.
it might just be a matter of, you know, yeah, logging it. I think logging how your symptoms, if you're starting to feel differently, and
Yeah.
then knowing like, all right, I need to save one or two just in case because I might have to break it up a little bit. Like you said, breaking it up. I've
Yeah.
had to do that too, like just breaking up those higher doses and when you start to feel the symptoms come on and
Hmm.
logging it and then then cutting them in half and taking just another half the next
Yeah.
day.
Yep.
So
That's the best way I would say is to just cut the dose slightly every other dose.
yeah,
And then you
yeah,
keep doing that until you're down to you're taking half a milligram for
yeah,
every other dose or whatever.
yeah.
And then you
But if
don't go
you're
through withdrawal. Even then I'll still feel a tiny little bit of withdrawal, but it's like a wisp of withdrawal, and
yeah,
I
yeah,
could still even function. It's not a big deal,
yeah.
but
But also think that people should, at some point, if you don't know and you're going through it, you really should go to your doctor and tell your
yeah.
doctor
Yeah.
because maybe they can give you something like there's Suboxone. I know.
Mhm.
I think that's maybe more for people who are like addicted and have
Yeah.
those
I don't know.
addictions.
Like, I feel like they should medically withdraw everyone who's on these drugs. Like, they should
Yeah,
have done it before I left the
they
hospital, you know?
should. They
Things like
should.
that. Like,
Or at least give you the directions so you know what to do when you get home in
but
case it
their
happens.
directions didn't even work. That's the other thing.
Yeah,
Like,
that's
they don't,
true. Yeah.
at least in Canada, in the area that I live, the pain nurses don't know anything. They don't know what they're talking about, at least not when
Mm,
it comes to Dilaudid. And I've talked to a lot of other people who agree with me and have gone through the same thing as me. You know,
yeah.
it's like they're st sitting there, they've never been in pain, they've never taken a pain medication, they've never been through withdrawal, and
Yeah.
they're judging me. And I
Yeah.
just think I wish you could see feel what it's like to go through this, because you would have so much more compassion, you know?
Mm. I
I think
can.
what I want to say before we end the podcast is everyone has their own what like everyone has to choose for themselves how they feel about pain medication, whether they're
Yeah.
willing to take it at all,
Right.
or certain kinds or whatever. Um, Me personally, I want a good quality of life. Like I'm a total natural health freak, and I have friends who judge me if I give my kid Tylenol, judge me if I take Advil. You know what I
Yeah.
mean?
Yeah.
And I obviously don't care
Right.
if
Right.
people judge me, but to me, because I've suffered so much Like honestly, like years and years of suffering where I
Hmm.
didn't know if I would ever walk normal again or ha
Yeah.
live without pain again or have
Yeah.
a normal freaking day again in my life. And I've
Hmm.
suffered so much that I just feel like I don't want to suffer more than I have to.
No. No.
So for me, I go back on Dilaudid when I need to,
Yeah. Yeah.
knowing that I'll have to wean off of it,
Yeah.
and I
Yeah.
just plan it out. That's just my
Yeah.
plan.
Yeah.
I choose no pain or as
Yeah.
little pain as I have to because I
Yeah.
know that when I'm not in pain, I have way better mental health
Yeah. Yeah.
and my quality of life is so much better. So I do choose pain meds. But
Yeah.
I mean, that's maybe not the best advice for someone who's in pain for years and is never going to be out of pain, you know? At
Yeah.
least for me,
Yeah.
I know that my pain is temporary every
Yeah.
time.
Yeah.
I
Yeah.
look at people who are on like pharmaceuticals for permanent pain that
Yeah.
they're in for the rest of their lives, and they have to
Yeah.
keep upping their doses because
Yeah.
it gets they get tolerance to
Yeah.
it,
Yeah.
and then they go through withdrawal if they try to get off of it, and that's how we
Yeah.
have quite an increase in even street level addiction is
Yeah.
because of people who started with pharmaceuticals,
Yeah.
and then when the doctors stopped giving them, and I did this too. I tried to find Dilaudid on the street.
Yeah.
And I sent people I knew
Mm.
out to try and find Dilaudid for me on the street when they were
Dang.
turning me down because I
Yeah.
was so desperate.
Which is so dangerous, you
It is.
know?
And thankfully they didn't find any and I didn't end up taking it. And I ended up, just going back and forth to the hospital until finally the social worker got them to help me. But um and at that time I honestly just thought I just needed Dilaudid because it's the only thing that works for my pain.
Yeah.
You know? And I was even trying to get it on the street. Like that should have told me I was going through withdrawal, but I just
Mm.
honestly, it didn't even occur to me. And then like you, I didn't want it, need it afterwards.
Yeah.
Once the pain was gone, I just
Yeah.
needed to wean off of it. But
Yeah.
people who don't get that relief where the pain doesn't go away, I really feel for
Yeah.
them.
Me
And
too.
and I admire anyone who has the strength to live in pain every day. I
Yeah.
have been there for years. For
Yeah.
3 years, I was in pain, and
Yeah.
you've been there where you're in pain every
Yeah.
day.
Yeah, I'm still going through it, but not nearly as much. Like I said, I've learned these coping skills that have helped. And I agree. Like, don't live in pain, do what you need to do, but also try other things. Like, be willing to try other things
Mhm.
because, um, you never know what's going to work for you because something works different for everybody. Like,
Didn't you go
you
to
know,
a pain clinic before
I
too?
actually going to another one.
Oh,
Yeah, like I'm
okay.
getting sent to a new one. But yeah, they kept trying these. They tried injections, then they tried a stimulator. But I woke up, this was last August. I woke up from surgery in pain and couldn't feel anything from my waist down. The doctor had to literally come in and just rip them out, send me to a different place to have an MRI because they were worried about something. I don't know.
Hmm.
I won't do I know a lot of people who have had stimulators, and they work for a period of time and then they stop working, have to have another surgery, the lead gets moved, but then you also aren't able to have MRIs as much, and that's happened to me before with another stimulator I've had. So
I
it's
don't know
like
what a stimulator is.
it's like a it's so there's different ones. I've had ones in my to try to help my urinary and bowel incontinence, and that's like they're like wires that are put into your spine and
Oh.
then implanted as like a battery device where you can control it. Yeah. Yeah, that's happened before. And then I've had that done and then there's been a um we have to pause it for a second.
I was like, do this,
It
Nicole.
stop. Yeah, I'm like what is going on? And then hold on.
You had the stimulators
Yep.
and
I've
you had it for the bladder and then for the.
Yep. And then from the car accident, I developed that complex regional pain syndrome, which affects my whole left leg. And they've tried the injections and then they tried a stimulator, which is a spinal cord stimulator. So it
Mhm.
goes into your spine and then you wear the pad. Yes, it didn't work.
That's
Not
also
doing it
so
again.
creepy having that in your body. Like
Yeah,
I've been suggested to me that I get a port because I get
I've heard
fluids
that.
every
Yeah.
2 weeks.
Yeah.
I'm like, I'm not ready for that yet.
Yeah. No,
I'll
it's
just sit there and cry while they try to get it in my vein every 2 weeks.
right. It makes other things harder and more difficult, like trying to get other tests done. Like right now, I just was on the phone scheduling more MRIs and two
Mhm.
PTs. It's like it gets tiring. It gets tiring. But I'm not doing, I'm going to a new pain clinic. I'm going to see new doctors about but I'm not doing, I already told my doctor, I'm like, I'm not doing these spinal cord things anymore. Like,
Yeah,
it's just not
I
happening.
wouldn't
I'm
either.
not messing with that
Doesn't
anymore.
work, and why, you know.
And I woke up in pain. And then the
I
whole
don't even let,
surgery,
before my surgery, I wouldn't even let anyone stick their finger up my ass anymore.
you're right, right?
I would have
Oh my gosh.
refused. I was like, no more.
Yeah. I don't blame you. I don't blame you. I feel the same way. Oh, yeah. There's a lot to be said, but I think ultimately it's learning how you can, you're right, like what you need for you, and it's
Mhm.
going to look different for everybody.
Yeah.
But
So
yeah,
anyone who's watching this and made it to the end, if you have a pain medication story or any kind of pain story, please post it in the comments and share it so that other people can,
yeah,
relate to you and see what they're going through. And
right.
we're all going through this
Yes,
journey, this health
yes,
journey together.
yes. Thank you, everyone. Thank you for listening.
Thank
And
you.
we don't know what our next episode is yet,
No,
but we'll surprise you.
yes,
We'll
we
always quick
will.
to surprise.
Bye.